Okay, let's just get right to it. Does ejaculating more often actually lower your risk of prostate cancer? You've probably seen this question pop up online, right? I mean, it almost sounds too good or maybe too simple to be true. So today we're gonna cut through all that noise and really dig into what the science has to say about it. And look, this isn't just some trivial question. The stakes are pretty high. About 1 in 8 men will face a prostate cancer diagnosis in their lifetime. That's a lot. So yeah, if there's any lifestyle habit that could even slightly nudge that risk, you better believe we need to take a serious look. All right, so how on earth could this even work? What's the thinking here? Let's dive into the theory behind it all. Okay, quick biology refresher. Your prostate's main gig is making the fluid that becomes part of semen. It's basically a little factory constantly producing this stuff. And that fluid, well, it can build up. And that simple fact is the key to this whole idea. Now, scientists have a fancy name for it, of course, the prostate stagnation hypothesis. But really, you can just think of it as, well, clearing out the pipes. The idea is pretty straightforward. If that fluid just sits there for too long, maybe, just maybe, some not-so-great stuff could start to accumulate. So the theory goes, regular ejaculation could help flush the whole system out. And that's not the only horse in the race. Researchers have also kicked around other ideas, right? Like maybe it's linked to lower stress levels, or a healthier community of bacteria in the prostate, or even how your body handles certain minerals. With all these plausible theories floating around, the next step was obvious. You gotta put it to the test. And that brings us to the landmark study that really tried to get to the bottom of this. And when I say landmark, I mean it. This wasn't some tiny weekend study. We're talking about researchers following over 40,000 men for nearly 2 decades. That scale is it's incredible, and it's absolutely crucial. Why? Because prostate cancer is a slow-moving disease, so you need that huge long-term view to spot any real pattern. I mean, think about that. This thing kicked off way back in the early 90s and ran for 20 years, with all these guys regularly reporting their personal habits. That kind of long-term dedication is exactly what gives these findings some serious scientific muscle. Of course, any good scientist knows you can't just look at one thing by itself. So, the researchers here were really smart. They collected a ton of data on all sorts of other stuff, physical activity, weight, smoking, diet, stress, you name it. They were trying to isolate the one variable and make sure that any connection they found wasn't just a side effect of some other healthy habit. Okay, so 2 decades of data, 40,000 guys, what's the verdict? What did they find? This is where it gets really, really interesting. All right, here's the big headline number that got everyone talking. Men who reported ejaculating 21 or more times a month showed a roughly 20% lower risk of prostate cancer compared to the guys who were in the 4 to 7 times a month range. That's a pretty eye-popping number, right? But, and this is a huge but, there's a critical piece of context you absolutely have to, and here it is. That 20% risk reduction, it was specifically for low-grade prostate cancer. We're talking about the typically slower-growing types, the ones that are often much less likely to be a serious threat. And that one little detail, it changes the entire story. So let me just make that crystal clear. The data pointed to a link with these lower-risk cancers, but for the really aggressive, advanced, life-threatening forms of the disease, they found no significant connection at all, and that right there completely shifts the takeaway. Which brings us to probably the single most important rule in all of science. Association is not causation. You hear it all the time, but it's so important here. Just because 2 things happen together doesn't mean one is causing the other. And that's the key. What this massive study found was a correlation, a link. It did not prove that more ejaculation causes a lower risk of this specific type of cancer. It seems like a small difference in wording, but it's everything because it leaves the door wide open for other explanations. So what else could be going on? Well, think about it. It's totally possible that men who ejaculate more frequently are, on average, just healthier in general, right? Maybe they have less stress, they're in better shape, they have healthier relationships, things the study couldn't perfectly measure. In that case, the ejaculation frequency isn't the cause, it's just a marker, a signpost of that overall healthy lifestyle. Okay, so we've looked at the theory, we've gone through the massive study, and we've hit the all-important caveat. Let's pull this all together. What does this actually mean for you in the real world? Well, here's what we can say with confidence. First off, there's absolutely no evidence that ejaculating regularly is harmful. 0. It doesn't seem to increase your cancer risk at all. Really, it's probably best to just see it as a normal, healthy behavior that might, might be one piece of a generally healthy life. And really, that's the bottom line for pretty much everything in health, isn't it? Our bodies are incredibly complex. Your prostate health isn't about one single thing. It's about your genetics, your age, what you eat, how much you move, the whole shebang. So trying to chase one magic bullet or a magic number, that's just never going to be the answer. So let's zoom out one last time and think about the big picture here, beyond just the numbers. The science is definitely cool, right? But maybe the real lesson here isn't that you need to start tracking your orgasms on a calendar. Perhaps the point is that a healthy, active, and fulfilling life, which for many people includes a healthy sex life, is just one part of a much bigger puzzle of overall well-being. So is the real goal not to chase a magic number, but to focus on building that entire picture of a healthy life? Because that's almost always the smartest